Oh, all right. Well, good morning to everyone, and thank you so much for taking the time out of your busy schedules to join us as we're launching this incredible opportunity for weight loss management here at Tanner. So this is a new benefit for us that we've added. It's a very much a holistic approach to help employees and dependents achieve their personal health goals. So if you guys can go ahead and move to the next slide. So the agenda today is to talk about the obesity and new therapy options. We are joined here by our pharmacist, Valentina Williams with Digital Medicine. So she's going to talk about all those criteria. As the program overview, how you qualify and what the exclusions are, and what does it look like for our members on our health plan, what those enrollment steps are, and again, the Q&A session at the end.
All right, well, I will go ahead and kick us off. Thank you everybody for having us this morning. We're glad to be here. Really talking about a very important topic, obesity. I'm sure you are aware obesity and overweight are, highly prevalent in the U.S. The World Health Organization defines obesity as a chronic complex disease that's defined by excessive fat deposits that can impair health. Similarly, the American Medical Association defines it as a disease state with multiple pathophysiological aspects requiring a range of interventions to advance obesity treatment and prevention. And the reason we want to share those definitions is not to bore you or give you some obvious information, but rather to highlight the fact that obesity is really complex. And there are a number of genetic, environmental, and personal factors that can impact people's ability to lose or gain weight. And we know that it's something that affects our population significantly. And really the reason that matters is that obesity is a risk factor, a major risk factor for a lot of other chronic conditions that we see, like hypertension, like diabetes, like kidney disease, et cetera. So the obesity epidemic is quite a problem in the U.S. You see there some stats, nearly 1 in 3 adults are overweight. More than 2 in 5 adults have obesity, and that includes severe obesity. And then ultimately about 1 in 11 adults have severe obesity. And that severe obesity is a very high BMI, higher than 35. So pretty significant prevalent problem. And really want to highlight that it's not for lack of trying, right? So on the right-hand side of the graph, you see a simple survey that the CDC did a few years ago. As you can see, it's data from 2013 to 2026. But ultimately, you see there that about 50% of adults have tried to lose weight in the last 12 months. And I think if we did that survey today, it would probably even more than that, right? So we know that people are constantly trying to lose weight. And again, because it's such a complicated issue, it's easy to get into a yo-yo pattern and be challenged by weight loss. The great news is that now, as of the last couple of years, starting in 2021, GLP-1s, which are a medication that has been around for a little bit, I'll talk a little bit about that, they now have indications for weight loss management. And so we have new tools in the toolkit that we did not have in previous years to actually address this disease in a holistic manner, just like Maddie said, right? It's not going to be it's not that the medications are a cure-all by any means, but certainly can help a lot more people make progress. So we're excited to share some about that today. And yeah, I'll continue on with the next slide. So talking a little bit about GLP-1s, and the reason we want to give you this level of detail is to really highlight a couple of things. And I think it's one, that obesity is really complex. 2, GLP-1s are great. But 3, there's a lot more that needs to be done. And so GLP-1s alone are not enough. But want to make sure everybody on the call is aware about how GLP-1s work and what they are. So let's start with GLP-1. GLP-1 is actually a hormone that humans produce naturally in their bodies that regulates blood sugar, insulin, and appetite after meals. And so what these medications, these drug companies have been able to do is actually mimic the GLP-1 hormone and create a synthetic version. And so that's the medication that we have. It's called a GLP-1 receptor agonist. And ultimately, they're able to mimic what this hormone is supposed to be doing and what it does in the body. And so, what does it do in the body? It stimulates insulin release, it inhibits glucagon secretion, it slows gastric emptying, and it reduces appetite. And ultimately, it's leading to significant weight loss in the body. So, great benefits there, right? So, improve blood sugar control. These medications actually were initially approved in the 2000s. Starting with diabetes indications. If you remember, the very first one, Victoza, then Byetta. There's 3 or 4 brand name products that were initially approved for type 2 diabetes. But the great consequence of these patients that had type 2 diabetes that started these drugs is that they actually lost a lot of weight. And so that led to the additional research for the weight loss indication, which is excellent. However, the medications have side effects. And so when you think about how the medication works, and how it slows down the way that your stomach works, the way that you think about food, the way that you feel full after meals or not full after meals, there's some side effects that we need to manage, and it's really important that we use these medications safely. Ultimately, we also know that GLP-1s are just one of the tools, and of course, that lifestyle is really important component. In particular, when people start on these medications, sometimes it can even lead to too much appetite suppression. So we want to make sure that we are responsible with the weight loss and that we're keeping patients safe and using the medications as intended. And so really that's the core of our philosophy as a program for digital medicine. We are trying to develop, as Maddie said, a more holistic program. She's going to tell you more about it. But really using these great GLP-1 agonists that is now part of your benefit, which is really great, to kickstart the weight loss and really put people on a path to better health. Maddie, take it away.
All right. So the goals of this program is really to combine lifestyle management with potential medication management for lasting healthy changes. So there are 2 tiers associated with this particular program. You will have the option, which is tier 1, which is a lifestyle management tier. This particular tier is for someone who is just not really looking for that medication platform, but is looking for health coaching, access to dietitian, and just some educational resources via the digital medicine app to help them in their journey. They may be in a level where they're just sustaining their weight. They have already had weight loss, and they're just looking for some additional resources. The tier 2 option is medication management. Now, with this particular tier, you have to be enrolled in the lifestyle management as well as the medication management. So this is a combined tier option. So you'll be required to complete all of the items in tier 1, which is lifestyle management, coaching, access to dietitian. But then in medication management, you will have access to the GLP-1 medication that will be prescribed via provider and the digital medical team or clinical team. So this particular medication management tier 2, to be eligible for this or either of these tiers, really, you have to be a Tanner employee and active on the health plan, whichever tier of the health plan. 18 years or older, either the plan member or their dependents are eligible for this as well. Go to the next slide. All right, so let's look at lifestyle management. Well, so this is tier 1. This is lifestyle management. And this particular tier offers telephonic dietitian support. So it's like having your dietitian and someone who's going to help you with diet and exercise and giving you some support there. You can reach out to them via the telephone number that we'll share later on, or via your virtual app. And again, in order to be eligible for this one, you have to be on the health insurance, either the employee or their dependents, 18 and older, with a BMI greater than 25. So what does the digital medicine app offer? It offers food and activity logs, educational resources, And this requires you to submit your weight and so that you can view your trends on how you're doing. So it is required to submit your weight at least once a month if you're in this particular tier. But the preference is really for you to submit your weight on a weekly basis. So what this app also does in this particular tier is give you access to the digital medicine care team. So your health coaches, your registered dietitians, really, they are there to help build sustainable behavior changes for long-lasting weight loss, to help you also discover tools and tips to make it easier so that you can stick to your healthy habits. So medication management, and this is tier 2, and as I've explained earlier, you have to be enrolled in the lifestyle tier 1 as well as medication management if you're choosing this particular option. So this is where your GLP-1s come into play. These are your Zepbounds and your Wegovy prescriptions. This is going to be the only platform for Tanner employees and their dependents who are 18 and older to get access to these GLP-1 drugs for weight loss. So again, to be eligible, 18 and older for this particular platform, you must have a BMI 30 or greater, or 27 and greater with weight-related disease. So with this particular platform, to get the prescription, what you will do is you will meet with a virtual meet with a provider who will review your criteria and eligibility in order to receive these medications to see if it's right for you based on what you have with your weight loss experience and some of the struggles there. And it will also determine at that point in time how the digital medicine team will titrate medications and what adverse effects may be associated with these particular medications. It's important to note that members, and so these are dependent employees and their dependents, are responsible for fulfilling filling the prescription and paying any copays and deductibles on the health plan. And as we're going through these slides, we will review our plan-specific criteria just to make sure that you guys understand as well. And to you, Val.
All right, so I get to repeat a little bit of what you said, but really dig into some of that criteria. So again, lifestyle management, just as Nani said, you really get to decide what that's going to be for you. So you get telephonic outreach from a health coach, and you work on whatever you think is a healthy habit that you can accomplish, and hopefully you can build on that and get motivated, and that can snowball into something great. For the lifestyle management, just as Nani said, a BMI of 25 or above. If you have questions about how to calculate your BMI, you can do a quick Google search and do a BMI calculator. If you don't know, still go through a portal. Katie will go through those pieces, and we will figure out, what if you meet the criteria or not. So no harm in starting the process if you have questions at all. But again, as I said, employees and dependents, 18 and up. And for the medication piece, of course, we need you to be 18 and up, have at least a BMI of 30 or 27 with at least one weight-related medical problem. Again, these are all based on the clinical indications for the FDA approval. So really matching FDA criteria and making sure the medication is being safe and used appropriately. And there are some clinical exclusions that we will go through later on. One thing I want to call out here, specifically around the weight-related medical problem, we want to be very clear that patients with type 2 diabetes, as I mentioned, GLP-1s have indications for both type 2 diabetes and weight loss. However, the way in which we use the medications is a little bit different. So any patient who has a type 2 diagnosis is not going to be eligible for the weight management program as it is today. There are other benefits that you all are eligible for, and medication coverage is different, but want to make sure that you all are aware that the type 2 diabetes program is coming soon. I think Maddie's going to tease it later at the end of the call, but anyone with type 2 diabetes is not going to be eligible for the weight management program, simply because it's not the safest approach to managing that medication, and it's just a little different. And besides that, we have additional clinical exclusion criteria that I think we're going to get into next. Maybe not next. Yeah, okay. So some of the participation requirements, we want to make sure that you are completing, Maddie, I took your slide, I'm sorry. Do you want to take this one?
No, yeah, that's okay, no problem. So basically, in order for patient participation requirements, so for lifestyle management, again, like we've explained, is tier 1. You must complete your profile in Tanner Digital Medicine in the sign up portal, and we will share the QR code at the end of the session to where you can scan the QR code so that you can go ahead and sign up using the sign up portal. Once you go through the steps of signing up through the portal, you will then submit your weight in the digital medicine app every week. This is, of course, is recommended, and for monthly, it will be required. It's important to note that members will not be provided with a scale, so you can use whatever scale you have, like a bathroom scale, or if you're working out at any of our Tanner facilities and gyms, use that scale. Just be sure to submit your weight. And then the other requirement is you will engage with your health coach and or your registered dietitian. So they will be calling you to establish what your plan is for logging your food. Give you some pointers based later on in this journey, to give you some pointers on the types of foods that you're logging, and also talking to you about exercise as well. So for the medication management tier, which is the combination of lifestyle and medication, there is going to be a virtual visit once you've registered. And then this virtual visit, you will speak with a provider, and you will begin your medication management if you qualify. This clinician is going to talk to you about the medication adverse effects and see how that applies to you, and also talk about the next steps as it is participating in the lifestyle program. It is important to note, as the manufacturer guideline for these GLP-1s for weight loss, you must maintain at least a 5% weight loss once you are on the optimal dose. So that is going to be part of their check-ins with you once you're prescribed this medication. Next slide. So let's talk about costs. And I think that is probably most of the questions that we've received in benefits is how much does this cost? Well, the tier 1, which is the lifestyle management and coaching approach, there is no cost associated with that. This is part of our benefit offering to you. So there is no cost associated with the tier 1 lifestyle management and health coaching. So where the cost is associated is on the medication side. So if you are prescribed Wegovy and Zepbound, the type of cost for the drug is going to be dependent on the tier of the health plan that you're enrolled in. So here we have all of our 4 tiers of the medication plan. You have the PPO low deductible, the PPO high deductible, in our health savings accounts plans, which is low and high deductible as well. So you must meet your deductible before the plan will start paying the copay amounts. So there is a cost sharing responsibility here as well. So we don't want you guys to go to the pharmacy and get sticker shock and not really know why. Your copays have to be met in order for these copays to, deductibles have to be met for your copays to start paying out. Next slide. All right, Val, kicking it to you.
All right, here's what we've all been waiting for. The clinical criteria. No, I just want to highlight, we are following the FDA clinical criteria, and to echo Maddie's point, we need patients to be successful with their weight loss, right? So that's where that 5% comes in. You want to make sure that you are losing enough weight, not too much, and you're being safe and taking care of patients. So want to call out a couple of clinical exclusions for all programs, but specifically for the lifestyle management program. Again, I talked about type 2 but also type 1 diabetes is going to be an exclusionary criteria for this. And that's because GLP-1s have not been, in the setting of type 1 diabetes, have not been approved for weight loss in this way yet. Any history of an eating disorder, again, anybody who has an active eating disorder should not be in a weight loss program, so that's going to be a clinical exclusion for this. Any patient who has a active dementia or is unable to really function, if you're unable to download the app and unable to communicate with us, that's going to be, you're not going to be able to participate. It's going to be an exclusionary criteria. Active suicidal ideation, I want to talk about this one a little bit because it sort of tends to scare people. This is really a leftover precaution from some of the older weight loss medications that we had. Way back when in the literature, there was some slight increase in suicidal ideations for patients who were taking some stimulants for weight loss. And ultimately, additional studies have come out, especially after the GLP-1s, that really don't support any additional risk of suicidal ideation here. However, any patient who has active suicidal ideation needs active care for other things. And so that's going to be an exclusionary criteria for this. And we will refer you to 911 and, make sure that you get the care that you need and come back when able. And of course, anybody who has a history of transplant. Our transplant patients are a little more delicate. And so we want to make sure that you are receiving this benefit, or, you're managing that in the way that's appropriate between you and your physician. For the medication management, again, we want to confirm our eligibility criteria, but really we also want to rule out some exclusionary criteria. So of course, GLP-1 medications are not without side effects. And there's some slight increased risk of thyroid cancer and also risk of pancreatitis when using these meds. So part of what we're doing in that visit is ruling out your history of that and making sure that it's safe for you to continue this medication, and also making sure that you've never had any other allergic reaction or any other contraindication based on the existing meds that you're on, as well as your medical history, et cetera, et cetera. We really want to make sure that you are well taken care of and safe when you're using this med, and that's how we look at it from a exclusionary criteria perspective.
All right. Yep. All right, Val or Katie?
Yes. All right, so we're going to talk about how to get started, both in the lifestyle piece of the program, or even if you are interested in the medication. So this is just a high-level overview, and I'm actually going to go kind of step by step in the details on the on the next slides. But we're going to get started on the Tanner Digital Medicine portal, so you can scan that QR code to visit the portal. There'll be some steps that you'll go through on the portal. Once you've done that, you're going to download the digital medicine app, complete the prompts on the screen, and submit your weight. And once you've submitted your weight, you are officially enrolled in the program. If you have elected to be interested in the medication piece and you are clinically eligible for that, there will be an action item listed at the top of the app once you open the digital medicine app. And there'll be a button at the top to schedule that virtual visit. So you'll schedule your visit with that digital medicine provider right inside of the app. And then on the day that you are set for your virtual visit, you'll get a text message 5 minutes before your visit with a link that will put you in that visit. And then you'll have that visit with the provider. And then if they feel that the medication is right for you, then they will prescribe that and get you started on the meds. So I'm going to go through each of these steps in a little bit more detail, just to make sure we answer any questions, or if anyone is stuck, we can get those things resolved. All right, so this is the homepage of the Tanner Digital Medicine, our sign-up portal. So you're going to start here in this white box, just entering in some basic information. On the subsequent screens, there's, you're going to put in your information, you're going to put in your weight, you're going to answer a few more questions. This is also where you're going to check if you're interested in weight loss medication. And then you're also going to sign our program terms and conditions, which essentially is our consent form. So once you've done that, you go through those screens, there will be a very important screen at the end that says confirmation and next steps. And this is what it looks like. And on this page, you're going to receive your digital medicine username, and that'll be really important to write down or just acknowledge. So that's going to be different than your Tanner MyChart username. So you want to make sure you make note of your username. And then just below it, there'll be a link to set your digital medicine password. So you want to click that link, and it's going to open you into a new screen. And this is where you're going to put in your digital medicine username, your birth date, and your zip code, and that will set your digital medicine password. So having that digital medicine username and password will be really important when you go to download the app, and that's the credentials you're going to use to log into the app, which will be different than what you're using for your Tanner MyChart.
So Katie, I just want to reiterate here because I think there's a lot of confusion for those who started the enrollment process earlier this year. It is important to note that when you get to this particular screen, this is not your Tanner MyChart username and password. So I just want to reiterate that it's not your Tanner username and password. So whatever username and password that you created on the confirmation and that's next steps screen when you, or the screen before that, when you enrolled, just note that is the username and password that you will use here. So I just wanted to make sure I just put extra emphasis on that.
Perfect. Thank you, Maddie. Yes, that is a very key piece.
Key component. Yeah.
Thank you, Maddie. All right. So yeah, after you've hit the screen, you now have your password. You said, make sure you know that. You've noted your digital medicine username, which, is different from your Tanner MyChart. And then from there, you're ready to download the digital medicine app. So the digital medicine app is in the App Store for iPhone and the Google Play Store for Android. You can even access those links by visiting digmed.org/DM app. There'll be links on that page specifically for the App Store and the Google Play Store. But once you open the app, this is the home screen of the app. There's a search bar here at the top, and you're gonna type in Tanner and it'll auto populate. So you'll make sure to hit Tanner, you'll hit login. And on the next screen, that's when you're gonna use that digital medicine username and password that we just talked about on the previous slide. So once again, it's not your Tanner MyChart information, it is your digital medicine username and password. There's gonna be a couple screens after you hit sign in. This screen here is really important. It's how long you would like digital medicine to be able to access your information. So as you're using the app, you're going to be inputting your weights and your meal tracking and all of that information that's going into the app. You need to be able to access that. So you're going to want to select at least 1 year on how long would you like to allow access. You choose that, hit allow access, and then you're in. So the subsequent screens are choosing a goal, setting notifications, and submitting your first weight. So those are the screens that follow. So you'll first set your goal of things that you want to work on specific to sleep, stress, eating, or activity. Then you're also going to set your notification time preference. So you are going to be reminded to submit your weights. And so that's a key component to staying in the program and a program requirement. So you're going to want to choose a time that's best for you. And then in that final step, you're going to submit your weight. And note, until you've completed this step, you are not enrolled. So you'll want to make sure that, to put your weight in at that time. Now, at the bottom of the app screen, you can get back to the home page by hitting this little icon here that says today. And there'll be a take action box at the top of the screen. So if you have indicated when you were going through the sign up portal that you were interested in weight loss medication, you're going to want to hit the schedule now button. You will have a take action indicator about scheduling that virtual visit. So I did see someone in the chat asking about, when is someone going to call me to schedule? They will not call you to schedule. You will need to schedule it yourself at a time that's best for you. So this is a video visit. So you'll want to make sure that you choose a date and time where you can freely discuss your health in a private location. So you will schedule for your visit right there in the app, which is nice and convenient. And then on the day of your visit, you will get a text message 5 minutes before your appointment time with a link to enter that visit with that provider. So that visit will take place. And from there, they will confirm, eligibility and make sure that the weight loss medication is going to be right for you. And then that's how you'll start receiving your meds. Also, if you've missed your virtual visit, you can reschedule by calling our patient services team. There's a number here, 855-486-3053. So if you missed that visit and need to reschedule, you absolutely have that option. Okay.
I just want to
yeah, go ahead, Maddie.
So Katie, I just want to add here, if
Yeah.
you're having technical difficulties, because if you're anything like me, they seem to find me. So if you're having any technical difficulties at all, and you're having challenges with the app itself, do call the 855-486-3053 number, and they will assist you. You can also call that number if you're unable to schedule via the app, or there seems to be an error or not really connecting with the dates. Do call that number and they will help you schedule that virtual visit as well. So I just wanted to make sure that I reiterate that folks know that they do have an additional resource by phone if the app does not work, but our preference is to use the app.
Perfect.
Yes, I really want to highlight that too, Maddie. Our team is really great at tech support. And so you are not alone. I know there's a lot of technical challenges out there. Please do not hesitate to call us. There's a couple different steps that are not, you're not used to them. So we're very used to that. Digital medicine is very familiar with those tech issues. So please call us. We're happy to help.
Excellent. Thanks, Val. All right. And I'll pass it back over to Maddie.
Yes. Well, so the key takeaways for this is that if you're looking to enroll in either tier, the lifestyle management tier or the medication management tier, you'll need to sign up using the sign up portal. And in order to do so, please scan this QR code. This will take you to the sign up portal so that you can go ahead and get started. I will notate that we will be posting these step-by-step screenshots on how to enroll on our benefits page. So for anyone to access in case they need that extra bit of help like I did. So we'll have that posted for you guys so that you can access that as well. It's important to note that lifestyle health coaching is available to all participants. And so this includes, of course, a dedicated, dietitian and health coach team, and a ton of information in the digital app library that you can access to help you with your journey. The virtual visits, just like Val and Katie talked about, that is, you can sign up via the app, or if you're having difficulty, you can call that number that we gave. But we're also really excited to announce that in the second quarter of this year, we will be launching chronic disease management as well. And so what this will do through the digital medicine app is this will be for GLP-1s for diabetes and hypertension. So stay tuned for some additional information. There will be some communication and another webinar just like this where we will talk about GLP-1s for diabetes and hypertension. I want to clarify that is not available right yet. We're still building out the platform. It is a whole different separate disease management piece. So we want to make sure that you all know that will be coming in the second quarter, and it's not available as of yet. We're still in the building process. So, ladies, thank you so much for working with us and with the overview in regards to this wonderful benefit that TNR has to offer. So I think unless you guys have any additional input, are we ready for questions?
I just want to add really quick to summarize all of the enrollment process. If you're interested in the lifestyle piece, until you submit your weight, you are not active in the lifestyle piece. So you have to go through the portal, you have to download the app, and you have to enter that weight. Once you enter that weight, if you selected that you're eligible that you are interested in medication management, you should see that as a take action card in your app. If you do not see that and you think that you should, please call us. But it has to do with your selections in the portal as well. So make sure that when you're going through the portal, you're answering those questions correctly and accurately so that you get guided in the right step. And then ultimately, if you're interested in medication management, you want to make sure you go ahead and schedule that visit. We have availability typically next day or the day after that, so there should not be a major wait. But we know that schedules can be tricky sometimes. But you get that visit scheduled so that you can start the process to see if you're eligible for medication if you're interested in that.
Thank you, Val. All right, I did see
I'll
one
also
question.
take a couple of.
Oh, sorry. Go ahead, Val.
Sorry, Katie. Let me just start. There's a couple questions in the chat that I've been looking at. I want to call out. Typically, it's mostly around the concept of patients who are already on GLP-1s, who've already had some weight loss, who are either are on it or have some history of it. Number one, you always want to make sure if you have any specialized management, for example, there's somebody who said they were working with bariatric medicine, right? Making sure that you talk to your doctor about this. Do you think this is a good program for me? Having that discussion, see if you're eligible. If you have questions about that, please talk to your individual physician or care team. But we do have the ability for you to continue the medication on this drug even if you no longer meet that BMI criteria. So anybody who initially met the criteria, has lost weight, is now on maintenance phase for the GLP-1s, please also still follow the steps to go through the portal. The process is the same. We still need to confirm your clinical eligibility and make sure it's appropriate for you to continue the medication, but that is also part of the program. It's not only for new starts here. So there's a couple different variations of that I saw, so hopefully that answers it, but let us know if you have any other questions about it. Go ahead, Katie.
Thanks, Val. I do see a question here. How do you intend to address maintenance? So Val, would you like to take that one?
Yes. So weight maintenance is a really important piece of GLP-1 use or any lifestyle program that we are using. So weight loss can be hard to get started, but also it can be hard to stay on the wagon, right? So that's what we hope that with digital medicine, using a combination of our lifestyle management with app, with encouragement from our team, with resources from our dietitians, that you're able to really make lasting change that puts you in that maintenance phase. Maintenance phase can mean many things to many different people. So, that's ultimately a conversation that you're going to have with your care team. But ultimately, patients do need to stay on these medicines to have sustained weight loss, and we will help you support that process as well, either through the lifestyle only program if you're interested in that, or a combination of the two if you're eligible.
Thanks, Val. I did see a question in the chat, Maddie. This is probably one for you. They were asking, for participating in the program, do you get the points that are associated with the insurance? I think.
Yes, absolutely. You will get wellness points if you participate in this program. In your Healthy Get Well app, and you can log your points there. There should be a drop down that will show the number of points that you're eligible for. So yes, absolutely.
Perfect. I see we're still getting some questions around cost. I know today we're sharing with people, if you have specific questions regarding cost, benefits, benefits@tanner.org can answer questions specifically around you and your plan and your deductible and cost.
That is correct. Because you have multiple people, that are on the health plan, and they may be enrolled in a different tier from the next person. So it just depends on which tier you're enrolled on the health plan. So if you have any specific questions about that, just email benefits@tanner.org, and we'll be happy to assist.
Thanks, Maddie. Another question here, and
hey, sorry, 1 second.
Yeah.
If I can just add, the question around the deductible that's coming up is kind of the timing of meetings for some of those plans that are in that higher deductible plans. We have heard from some patients that they would like to hold off on starting medication until they meet that deductible. And I just want to give a general disclaimer out there. Reach out to the benefits team, understand how your deductible works. because depending on your own situation, that may or may not be the best approach. So yeah, lean on the benefits team for sure, and make sure that you can take advantage of this benefit if it's right for you.
Thank you, Val. I have a question for someone saying that they had called to register their family, and I will say, and Val, please chime in here as well. If you are wanting your dependents to enroll in the program, they're going to have to set up their own profile. They're going to have to go through the portal themselves. They will have to, create that digital medicine username and set that password. So, it's not something where you can, it can't be all under one individual person. It's got to be, individual records for each person, even with your dependents. Okay, let's see if we have other questions. I'm interested in starting the medications. Do I have to use this program, or can I still use my own provider? Mandy, do we want to answer that one on the benefits side?
So yes, so in order to get the weight loss GLP-1s, you have to go through this platform. So you have to sign up. Some of you guys are already on this, and there was a letter that was mailed to your home address that gave you the next steps in order to enroll into the digital medicine platform in order to continue receiving the GLP-1s for weight loss. So this is going to be the only way that you'll be able to get the GLP-1s for weight loss on your health plan.
Perfect. I think, there's some comments in the chat. I think some are still maybe having some difficulties. I want to go back to this slide with the phone number. Please, give our team a call, 855-486-3053. We certainly want to make sure anyone that's interested is being taken care of, and we will certainly help you.
Mm-hmm. Yeah, I can see in the chat that there are some comments about just having difficulty registering. Don't hesitate to call the 855-486-3053 number. They will be happy to assist. Now, just like any call center, when you're calling in, there may be a wait time until they can get to you. That's just to be expected depending on times of the day where they get high volumes, but just be patient. If you're having difficulties that you feel like the benefits team can jump in and help you with, don't hesitate to email us at benefits@tanner.org. And then someone from the benefits team will help assist you as well.
Great, thank you.
And I just want to make sure, Val and Katie, if we can just reread the disclaimer, that would be fantastic. I think that there was a question about those who did not hear what that was.
Yeah. So today's webinar is designed to provide an overview of the Tanner Digital Medicine Weight Management Program. Medication, if clinically appropriate, is available for up to a $70 copay per prescription. Members enrolled in a health savings plan must meet the deductible before the copay amount can be applied. And if you have any questions regarding your specific cost, please contact benefits@tanner.org. And Maddie, I'm glad you answered you mentioned the letter that was going out to individuals that were currently on the medications. I think there's quite a bit in the chat and the Q&A about, being on these medications previously and, how the new benefit will impact them. So thank you.
You are so welcome. Absolutely. So if you've received the letter, do be sure to comply there's a deadline that you'll have to comply and enroll in order to continue receiving your meds. So do register and get that done before the deadline passes. If I'm not mistaken, it's at the end of this month. I think it's like February 28th or so. So do make sure that you register. There's a question about if we're able to link the digital medicine app to our Apple Watch. I don't think that is an option at this time, correct?
That's my understanding, Bob. We have new features coming all the time, but I don't think that one is currently an option.
Let me confirm that. We'll get back to you. We'll put that in the FAQ.
Thank you.
All right. Once again, I want to reiterate that the phone number here, and even Mal had said, there's different options on this line, but, making sure that you're selecting tech support will get you to the right place much faster. So, all right. Here's the QR code again to get started. But yes, we will be sharing the recording link, and you can, those will have the enrollment steps there if you're getting stuck, but really if you need help, calling that number we can certainly support you there. Okay, let's see. There is a question about currently being on a med with your PCP, and now you're on it for maintenance and you're under that 30 BMI. Are we going to continue to cover the medication for those individuals that are on the med currently, but now are no longer at that BMI?
I think that was the question around maintenance and patients who are actively taking the med already. So same process. If you're going to continue taking the medication and you've been using it, you should be able to follow the portal steps. You still need to meet with one of our providers to confirm eligibility and criteria, but you should be able to continue the medication as long as you meet those things.
Great. There's questions around the app with the food logging. I do believe we've made some recent enhancements to that. Now we have the ability to take photos of the meals, and they kind of the calories and the macros kind of auto-populate into the app. Val, is there anything else that you want to mention around like the food logging capability?
No, really the food logging capability, I like the feedback in the chat. We're always looking to improve the app. I already sent that over to some of our team members, so thank you all for the feedback. Really what we're looking for is a way for you to have some accountability around entering your food and keeping track of a food log. So those are the features that we have. There's a voice to text. There's also a feature where you can take a picture of your meal and it can calculate calories. Really the idea is to make you mindful of what you're eating and tracking. But absolutely, we're always making improvements to the app. And if you have any feedback, I believe there's also at some point you'll get an opportunity to give feedback on the app itself. You'll get a notification in there. Please feel free to put your feedback in there as well, because our team takes it very seriously.
Something to mention about the app really quickly. The app is real time, meaning that if you forgot to log your food yesterday, there's no way for you to go back to the day before. So you'll have to log it on the day that you're tracking your meals. So just want to mention that. I know with some other food tracking apps, you have the ability to go backwards and add throughout the week. But with this particular app, you have to use it in real time in logging your food. So just want to make sure I throw out that tidbit. The picture, taking the picture of your plate rather than searching is such a great feature. So you're not having to search for what type of food you ate or, or the size or portion. That's where that AI capability is at. So it will calculate that for you. So do take the picture and it will calculate what that is for you. That's easy.
Katie, there's a question in the chat about the 5% weight loss I'd like to take for the group.
Absolutely.
And this might be our last question since we're almost at time. Again, part of what the digital medicine program does, and I think there's a couple questions in the chat. I'm already getting this through my doctor. Why is this different? And what is the benefit of this? Really, the digital medicine program is a focused, approach to obesity and weight management with really strong clinical and safety criteria. So the 5% weight loss that we alluded to really has to do with making sure patients are losing weight. and can continue on these medications. So it's rare, but there are patients who actually are not responding very well to GLP-1s. And so really the cost benefit of someone continuing to stay on a medication that's very expensive and they're not losing weight really is not, it's not a very good value proposition, nor is it a good thing for the patient because you're exposed to side effects without really any real benefit. So part of what we are doing in digital medicine is really tracking that you are losing weight, that you continue to be safe, that you continue to have to manage those side effects and are doing what you need to do. If at some point you are determined by our team to not be making that clinical progress, once you are optimized on the dose and once you've had many discussions with the team, it's not something that we rush or take lightly by any means, but you just, may not be the best candidate for medication going forward if you're not really losing weight with all of these resources. So not a hard and fast, we want to make sure that you are successful with this medication. If you're not successful with this medication, then you maybe should not continue taking it. And that's where that 5% comes from.
Mm-hmm.
Thanks, Val. I'm going to make one more call out because we're getting quite a few comments in the chat. When you do get to this login screen after you've gotten past or you've chosen Tanner Health, we do understand this does say My Chart, but please enter your digital medicine username. We are looking into resolving this, but please, I know it does say My Chart, but it is your digital medicine username and your digital medicine password that you will use on the screen to get you in. So understand that is confusing and we acknowledge that, and I'm sorry, we are looking into resolving that, but yes, please enter your digital medicine username in this field and the password that you've set. Well, I think Val, maybe we have 1 minute. I think this is a good clinical question. If someone meets their personal weight goal and wants to discontinue the program, how does that work? Can we take that one before we go?
Yeah, absolutely. It works as a conversation with the care team, right? Whether it's our digital medicine care team or your provider, I think that's absolutely something that we can help you with as part of the program. So just encourage you to talk to us and follow the steps to the portal and get enrolled if you're eligible. It's a great program. And for anybody who's having trouble logging or has any questions about the app, also contact our tech support team. They're able to help you. But ultimately, it's a guide. So, if you're not able to log today, log tomorrow. The idea is to build a small sustainable habits to get you there. So don't get hung up on maybe a little tech glitch.
Perfect. That's a good reminder, Val. Thank you.
And we will be posting the step-by-step instructions for folks to see. Sometimes it helps to have that visual as you're looking at the screenshots too. So we will be posting those for you all.
Perfect. Yes. Thank you, Val. There's no copay for that virtual visit if you're interested in the weight loss medications. All right, well, we are at time. I want to thank everyone for being with us today. Thank you, Maddie. Thank you, Valentina. We will be sharing the recording link that you can watch on demand. And like Maddie said, we'll also be sharing the step-by-step guide that you saw today during the presentation. So yes, if you're interested, scan to sign up and take note of the tech support number if you need help. We want to help you. If you're interested in the program, we want to help you get started and be there and offer support. So hope everyone has a really wonderful weekend and a nice Friday. And yeah, thanks again.
Thank you so much.